Craig Cooper, CEO of Positive Life New South Wales. Positive Life New South Wales is people living with HIV community organisation, so the HIV representative peak for New South Wales. Principally we're funded by an NGO grant through New South Wales Ministry of Health, and they've been our core funder for since the organisation started. We have a very close and productive working relationship with the Ministry, and we also get some supplementation funding through the City of Sydney, through MAC AIDS Fund, so MAC Cosmetics, and we often get one-off donations from communities, from the community itself. We have peer support programs, information and referrals, treatments advice, health promotion campaigns, peer support activities such as discussion groups and forums, and we provide health advice and policy advice to either HIV sector partners or to the Department of Health. So we've been running now for 27 years, which has been a pretty good run for a small community organisation. And it's a peer-governed board or peer-governed organisation, which means that people with HIV run the organisation, are predominantly employed by the organisation and within the organisation, and represent people with HIV throughout New South Wales. So we're located in Surrey Hills in metropolitan Sydney. We're in the centre of the HIV epidemic within New South Wales, but we do rural outreach on a regular basis, so go to Newcastle, Lismore, Coffs Harbour, Bega, Wagga Wagga. So we go to a range of places throughout New South Wales to run discussion groups, community forums or education sessions. And we also do have a 1-800 number in terms of a telephone free call, and provide information through social media and websites. So we try and extend the reach as much as possible to regional, rural areas and out of metropolitan Sydney as well. It would range from individual or one-on-one support with other people with HIV. I'm HIV positive myself. And we would either be doing face-to-face support or through emails and providing information or over the telephone. Or we could do small group discussions where we're providing support that way. Or we do what's called systemic advocacy, where we identify a problem within the health system. So if we're doing patient advocacy and peer support for people with their clinicians or with a health service provider, sometimes that could be representative of a gap or a problem within the health system, where we then start developing a position paper or a policy paper, and we start advocating government to make a change. So that's some of the patient advocacy or the systemic advocacy and support that we provide either to the health system and to government, but in particular to people who live with HIV. We have numerous ways that we engage with and talk with community members. They could do it either via email or the website. They could do it via Facebook. They could do it via telephone. They could come to one of the community events and social inclusion programs that we run, such as the quarterly or peer-to-peer. They could drop in and come and visit us at the office, or they could come to one of the focus groups and community forums. There's lots of different ways that people could get involved or get in contact with us. On a monthly basis, we would have via email and telephone, we would have anywhere up to about 50 inquiries, so 50 points of contact with positive people. We would have anywhere up to about 40,000 contacts via Facebook and websites. And we constantly send out e-newsletters and emails, and that's typically reaches anywhere up to about 600 to 700 people each time we send out email communications. So we're frequently engaging with and interacting with the community at large to make sure that there's a certain level of awareness around what's going on for people with HIV, and so that we can combat stigma and discrimination wherever possible. I think there's been quite a change in the way that the agency works and the epidemic within Australia and New South Wales. We're at a very pivotal point in time in terms of constantly engaging with and consulting with people with HIV so that we're making sure the messaging and the advocacy that we do up to government and to other service providers reflects what the needs of people with HIV is. I think this is a really critical point in time for people living longer term with HIV because we're an ageing population, so 55 and over, anywhere between 20 to 40% of people living with HIV in New South Wales, and there's roughly about 11,000 people. 20 to 40% of those people, in terms of comorbidities and multimorbidities, as we're ageing, it's not easy living with HIV. So I think this is a very important moment for us in terms of how we support other people with HIV and how we care for our community. So it's very exciting being a part of that response and the way that we work with people with HIV throughout New South Wales.